Hello everybody, it's Astra, and today I'm going to be talking about my experience with talk therapy and why I don't think it works in a lot of cases for individuals that are experiencing severe mental illness. Um, and I just want to start off the video by quickly saying three things. So one is that I'm getting a haircut soon, so finally I'm thinking of getting micro bangs or maybe a pixie cut. The second thing is that I took a trip recently to New York to celebrate my step grandfather's birthday and to meet my cousins and my aunt. And we also went to a few sites where some of our relatives have passed away, like where their remains are, and that was quite emotional. I might talk about that in a future video soon. And the third thing is nothing has really changed about my plans or about my life. I'm just kind of going to, I don't know, kind of take these next couple of weeks easy, maybe make some videos. I plan on some big changes coming pretty soon, but that's all. That's all. I just wanted to get those 3 points out of the way. So, today's video topic is going to be why talk therapy. I'm not going to be talking about other types of therapy, which I am actually seeking. I am seeking alternatives to things like talk therapy because it has not worked for me. Today we're going to be talking about talk therapy in particular. So the other therapies, not really. I'm just so I'll be talking about why I think it is a massive failure in a lot of cases. So the thing is with talk therapy and with therapy in general, and I even listened to a therapist on, like an ex-therapist on why, like a former therapist on why she quit her job. The main problem that I have with talk therapy is that it works in some cases for individuals. And it really depends on who your therapist is. But the main idea behind it is that they want you to talk to yourself. They want you to talk to yourself through your problems. And by like talking yourself through the problems and everything while they're sitting next to you, it empowers you to be able to take change, to do positive changes in your life and resolve the potential conflicts that you have. Now, for people that are very highly functioning, that have, maybe are suffering through grief. Now, I don't want to speak for all people here. What I'm basically going to say is for people that are in therapy for general reasons, or that have, mental illness that maybe doesn't require as many needs. I'm trying to be very careful with my language here because I don't want to kind of stereotype all sorts of people. And basically what I'm going to say is that it works for a lot of people that are able to have productive lives, that are quite mentally kind of strong and are struggling, like kind of they're like, how do I explain this? This is so hard to explain. They don't have severe mental illness that significantly impairs their functioning. So it works for the vast majority of people because only a sliver of people in the general population has severe mental illness that impairs their daily thought patterns, their functions, like eating and sleeping and things of that sort, right? So kind of the general population, it works in a lot of cases, especially if you have a good therapist. But what happens if you're not part of that large percentage of the population? What if you have bipolar disorder, severe bipolar disorder, and you're struggling with suicidal ideation? Suicidal ideation, right? We'll say, how or we'll just say like major depression, right? That keeps coming on over and over again, right? So if there is something that's making you severely depressed in bipolar disorder or major depressive disorder, you're likely thinking about the same problems that are bothering you over and over and over again, because after all, that's why you're depressed. Now, keep in mind that sometimes depressive phases and like bipolar disorder or major depression or or like severe anxiety about something can come on for relatively like small or even seemingly non-existent reasons, like it's just kind of a natural cycle. But a lot of times there's something that's very distressing that's on your mind that's causing you the problems that you're having. Maybe it's issues with employment, with school. Maybe it's that you're dealing with chronic physical illness like POTS every single day of your existence, which makes your life very, very difficult. And so you have lots of time to think and to make self improvements, so to speak, right? So, for example, I think all the time, like, well, maybe I should just go out to a restaurant and enjoy the night. I'm struggling quite a bit. Maybe I should go walk around my local lake, take a hiking trail this weekend. Go to watch a favorite video of mine that I haven't seen in a couple of years that I really like. Uh, an example of this is I've gotten into Violet First recently. They were one of my favorite childhood YouTube channels. And they're skits, by the way. They're not actually real. So the main issue that I have is that if you have a lot of time to think about these things and you're actively trying some of these things out and they're not working because your problems are very severe, what I'm basically saying is that it doesn't always work. And sometimes you need a different approach other than internalizing how you're going to solve your problems and empowering yourself. Not everybody has the capability to do that by themselves so easily. And so when you have talk therapy and you're having these problems that, again, only a small percentage of the population, especially persistently, will have this kind of issue, because a lot of people can find solutions to their problems and apply it to their lives, and it goes fairly smoothly, right? Because they're kind of less impaired, like less impacted on that portion of their lives, because they don't have as severe mental illness, so to speak. So, and I'm not saying that somebody that is diagnosed with a severe mental illness can't do that. I'm saying that it is much, much more difficult, and you can definitely lose ground over time. Like, it can definitely, severe mental illness can exhaust you to the point where you're no longer able to really do that. So, yeah, like, so for me, when I go into talk therapy, it's like, okay, I'm doing what I do 12 or 13 or how many hours a day that I'm awake, right? Which is that I'm taking a look at these problems. And I'm even doing things like walking out to lake, everything like that I've mentioned. And it's not really solving the issues that I'm having. Especially, it's not going to solve chronic physical illness, which I already take meds for. And I'm trying new solutions as time goes on. I mean, I'm not going to say that I've given up on trying things, right? I would say I am at the end stage of, I would have what they call end stage psychiatric illness, which I do think is a real concept. I do think it is something that I'm going through. I do believe that I am truly at the kind of end stage or finality of a course of a mental illness, which is very scary to think about. But at this point, I'm pretty happy, like, of accepting it, I guess. But I mean, I'll try. So when you go into talk therapy, it's like you're already doing what talk therapy is meant for you to do, which is to empower you to basically brute force through your problems, figure out your problems. But sometimes you need advice. Sometimes you need somebody else to kind of work out plans with you, or maybe follow up with plans with you, help you around the way. At the end of the day, it is your life, it is your person, and so you ultimately have to be the person, no matter who you seek, that solves those issues, right? Your life coach cannot fix your relationship with your sister. I don't have a sister, right? But you get what I'm saying? Like, I understand that, but I'm talking about things like advice, things like kind of motivation, kind of steps that you can kind of take with them, kind of, like more interventions than just talk to me about what your plan is and then somehow that will solve what you're going through. It doesn't work for everybody. And I think a large part of why talk therapy is like this has to do with legal. So, if you're dealing with some patients that are homicidal or suicidal or have, mental and physical deterioration or in high risk states like that can lead to death in some way, um, as a therapist, and especially when you're working at private companies, private, offices, therapy offices, they are very, very careful because they don't want to offer you advice or ways to solve problems that could potentially land them in legal trouble. Because if you do end up committing suicide or homicide, they, that's a very serious thing, and they could become part of that kind of. They're at least afraid that they could become part of um, that legal, mess. So that's why a lot of therapy offices fail to give things like advice or like structured interventions on how to solve some of your biggest problems with, severe problems, severe mental illness or severe trauma. It's because if you actually end up, if it backfires in some way, or uh, the client took your advice, it could lay the therapists and the private offices that kind of conduct these, that are kind of in charge of counseling, they're very, very afraid of a lawsuit. Even though there may be disclaimers in the legal title, when you sign up for therapy and everything like that, they're still afraid. That's what I've heard from a former therapist, and it's absolutely 100% true. Um, so that's one of my reasons for why. Now I want to move on to something more personal, which is active suicidal ideation. Now, I'm not talking about active suicidal ideation as in right now after I get off this video, I'm going to. That's not what I'm talking about. What I'm talking about is over a series of months and years, I've had a very, very large amount of suicide attempts, active thinking about suicide, things of that nature, right? And this is not going to be a really personal video talking about heavy things and, mentioning graphic details. I will say this, which is that a lot of these therapies, I went into a therapy for suicidal individuals. I forgot what the acronym was called, but it was one of the offices here in town where I went to do therapy. And what I found out about it is that, again, they don't really give you advice on how to solve issues like severe problems. I mean, they give you things like meditation or breathing exercises might help you, but if you're in some sort of severe crisis, like interpersonal crisis, or it's not, breathing exercises are not going to be what you're thinking about when you're going through such a such turmoil in your life, if that makes sense. It's like bare minimum of what you should be getting as far as tips and tricks on how to manage these sorts of emergencies, crises. So what I found out about the therapy is that they half the therapy session or 20 minutes of the therapy session, they would give you rating scales. So like on a scale of 1 to 10, how suicidal have you been recently? Um, have you been agitated from 1 to 5? Have you been isolated from other people from 1 to 5? Right? This was especially an issue because of the office where I was at had an inpatient. And I'll tell you why it's such a problem here in a minute. This is a private company, remember that. So, hold on. I always have this problem. I don't have GERD or anything. I don't know why that happens. So basically, right, so 20 or 30 minutes of the session is basically repeating the same thing over and over and over. And because this is like for people that are suicidal, you do it every single week. You follow up once every week with them. And you start to kind of lose your mind and kind of conform to the scales. So obviously one of the first problems is that, especially if you're going in with somebody with active SI, like if you're somebody that's going in because of a recent suicide attempt into these therapies, and you score really high on the rating scales, there's a significant chance that you will be hospitalized. And obviously, legally they'll use those rating scales in court if you say anything. Like, well, this, Astra, she just put, a 9 out of 10 on the suicidal rating scale, right? And so they'll put you in an inpatient ward, which is already hell. I have a video on that called Why Would I Be Transparent that explains it. But basically, think no rest, no movement, very restricted freedoms, very restricted legal rights, especially if you do not have like stable job and employment and money to fight whoever is kind of keeping you in the ward involuntarily, right? So like a credentialed psychiatrist is going to be able to afford better legal representatives, and of course their credential is, they've been studying medicine for what, 10 years, and you're just, a severely mentally ill patient. You probably may, because of nature of severe mental illness, you may not have a good job and employment. Basically what I'm saying is you're David versus Goliath. You have no control over when you leave, even in voluntary. No freedoms, not really any choice on food or water, and they kind of just treat you like a child. Like the activities there are like word searches and things like that. Group therapies are also often, present. Like you have to be involved in group therapies, including very early in the morning after very limited hours of sleep, and in a very subpar environment. Which doesn't help because the group therapies and even the individual sessions are still talk to me and try to empower your way through, which again is only one method that works for some people, and some people need more than that. But because of legality, the possibility of lawsuits in particular, and just kind of the traditional way of thinking about how therapy should go, there's not really anything there. I mean, there could be some therapists, don't get me wrong, that are like that, especially individual, like practicing therapists, but those are going to be harder to find. And I'm just talking about talk therapy. I'm not speaking for other types of therapy. So, the main problem that I have when I was in this suicide prevention therapy is that I found that, so think of a sinking ship, right? So think, I don't know, a ship brushed up against like a rock or something, right? And water's pouring in the ship. What I find about these, suicidal ideation therapies, if you're inpatient for being suicidal or even homicidal, is that they want you to get a bucket and pour the water out of the ship, right? That's good. right? Because if the ship sinks, you're dead. Let's just say that the ship sinks, you're dead. So they want you to keep pouring out water from the bucket, and they don't want you to give up, right? Giving up is you die. You die, in this case, from some sort of psychiatric complication. Okay, that's nice. We need to get the water out. But we also need to patch the hole, because the hole is ultimately where the water is coming in, right? And so in these therapies, they'll talk, if you say to your therapist, I'm suicidal, they will create a safety plan for you. They will reach out to family members to make sure that you are safe. You may be hospitalized, even more so if the private company you're with has an inpatient. We'll discuss why soon. Which for me always terrified me because of this realization. We'll get into it. But the point of the matter is that there's something that causes suicidality. 99% of people do not want to, initially at least when they start getting SI, they don't just want to die for the sake of dying, right? Like, I'm sure a few people find death appealing just because it's different, you know, and they think it's cool or something. But 99% of people want to live. They want to choose to live, at least in the beginning stages of SI or serious mental illness. And so when you tell the therapist and the therapist gets really concerned, creates a safety plan and everything like that, they're preventing the suicide, but they're not preventing what's causing the suicidal ideation and the planning or the attempts, right? So if it's employment status, like not being able to find a job, super common problem these days. They'll talk about, we need to make sure you're safe. We need to make sure that we can keep you intact. We need to make sure that people can look out for you and that you don't harm yourself. Okay, that's cool, right? You're keeping the ship afloat by getting the water. But the issue is that the hole is never patched, right? Which is, here are some tips that you could use to find employment. Maybe here's a reference to a job coach that you can find. Maybe we could get something, I don't know, some sort of like, legal support for you if you're highly, I don't know, on the spectrum and need like somebody to help you, assist you with like job applications and stuff. You know what I'm saying? Or like a supportive peer. So they're basically like, we're going to prevent you from doing this. You just have to keep filling up the bucket over and over and over and over and keep dumping the water out. But we're not actually going to patch the hole, which is unemployment and job status, which is causing this mess in the first place. And can you guess where that gets you? It gets you exhausted, and it makes you want to put the bucket down and the ship to sink. I am one to actually believe that if you put enough duress on anybody, that they will commit suicide. I am a believer, a strong believer in that it is kind of a brain's natural reaction. It's like biochemistry, it's science. 100% of the people, if there's enough stress, will do that. Some people just have extremely, extremely high tolerances because of religion, or because of, maybe it's very immoral in religion or their culture, or I don't know, they just have, a high bucket fill line. But that's my belief, is that eventually, and it's not free will. So eventually you're going to want to put the bucket down, right? Because it's getting exhausting and the hole isn't getting plugged. And you need a rest, you need a break at some point, right? There's only so much you could do. And when the therapist or your team sees that you want to put the bucket down and the root of your problem is not getting addressed, they'll put you in inpatient. Because they're saying, okay, well, you actually want to die. Like, so you're not safe. So we need to do even more interventions. And when you go into the involuntary, obviously with all the things that I mentioned, plus the fact that there's not really anything above talk therapy, sometimes they won't even give you a diagnosis. And that's big, because a diagnosis is required for things like medicine. I hear often therapists will say things to me like, well, why do you like labels so much? Because when it comes to legality and when it comes to prescriptions and when it comes to insurance and when it comes to even how therapists will treat you, because some therapists will be like, well, you weren't diagnosed with this yet, so let's be careful, right? When that label matters, right? I don't like hardcore labels either, at least without qualitative like analysis or descriptions or whatever, right? I think that's kind of bad. Like, I think it's kind of harmful. Like, labels are, can be harmful. But they matter in medical. They absolutely 100% matter in medical. And so you're going to lock me in here in involuntary and take away all my freedoms because of severe mental illness. Yet you're not even able to diagnose me with mental illness? And I'm not able to get medication or specific treatments, like an endorsement for specific therapeutic treatments or specific interventions, because you won't diagnose me even though you're taking away all my freedoms due to a quote-unquote severe... So you're basically putting me in this ward for a severe problem, but you're never going to diagnose what's wrong. And at most, you'll just give me an unspecified diagnosis, which isn't taken as seriously. So, so you have a very, very broken ward system for that reason. And what is obviously going to happen when you get put in involuntary, you're going to want to put the bucket down even more. Because they're still not, they're actually creating more trauma and stress for you and making the hole bigger in the ship. By doing that, by trying to save you, they're actually putting more water in the ship, which is you're more likely to sink. You see what I'm saying? And you're more likely to end up in some sort of very legally bad situations. Since psychiatric patients, there's a lot, some sort of like legal psychiatric complication, suicide. So, significant deterioration, the more they do that. So that's the main problem that I have, at least with talk therapy. I cannot speak to things like CBT or DBT. I think those are harder to access. But I could talk to treatment specifically for suicide and for general talk therapy. That is horrendous how things are right now. And there are also a lot of hospitals that will have therapy programs, and they happen to have an inpatient ward, and even sometimes they'll have a crisis line. So what do you think will happen if you call a private company's crisis line, and the private company will make a lot of money if they put you in inpatient, either through Medicaid, Medicare, or through your income? I wonder what they would do. They would probably put you in inpatient if you called the crisis line, or they would be very, very liberal with putting you in inpatient. Because it makes sense. It makes sense financially. Right? And a lot of the laws surrounding psychiatry, psychology, what the law deems threat to a self or threat to others, can be determined in the law's eyes through a therapist, through a psychologist, a psychiatrist that's been in school. Right? And so, but again, that's very subjective. That's a very, very subjective thing. And a lot of therapists or psychologists could just say, well, I know it when I see it. They could just say that, right? And again, if you try to legally go against it, as somebody with severe mental illness that's probably on the lower side of the income ladder, going up against, a private company or individuals with much more credentials, understanding of psychiatric law, that are able to afford better lawyers because they have more financial resources, you're up against a losing battle, right? And so these individuals they are way they are way superior to you. And so if they can say that you're a threat to yourself, and you have very little ability to kind of, and I know this is a little paradoxical to what I said earlier about therapists and psychiatrists being um, you know, scared of like recommending advice to their patients and things like that. Um, but what I will say is that's different, because if you're like, it is a big thing if the laws, questioning whether you're responsible for someone's suicide or for someone's homicide. That's a way different situation than having to defend yourself in court because you have a trained credential and a lot of practicing experience, and you put somebody that called the crisis line, which, okay, it's a crisis, into inpatient. You're in a much more stable position by being in that versus being in the case of possible negligent homicide, if that makes sense. I know that seems kind of paradoxical, but that's where it's at. So yeah, basically, right, if you call one of these private companies crisis lines, especially if they have things like intensive outpatient or inpatient partial hospitalization programs, it financially makes sense for them to commit you to a ward. And they can be very liberal in that interpretation. And even the people that work there that may not want to do that to their patients because they think it's kind of exploitative, they could get fired if they don't do that by the higher ups, right? That get, $5,000, probably not that high, like $1,500, $2,000 off of inpatient stays for 48 hours or whatever. So that's all I'm going to say there, right? I could go on and on and on about all of the kind of problems within the inpatient the inpatient hospitals. I could go into all sorts of things, but that is my kind of experience, and so, you know, I'm not gonna talk about 988. I already have problems with 988, obviously, that I'll talk about in the future. But I'm just gonna be talking about like therapy offices and their crisis lines, or companies that offer private therapies crisis lines. If it financially makes sense for them to do it, to commit you to their hospital, because the staff will be out of a job if there's no patients there, and therefore no revenue. So, and if you actually see, if you think this is all just a coincidence, like, okay, involuntary hospitalizations, they work. They work in the United States and they stabilize patients. The rate of involuntary hospitalizations in almost every single state has increased from double to triple over the past 20 years. And that's an increasing graph, even when accounting for the COVID lockdowns, which fucked up a lot of people, including myself. So it's not just me, in my perspective about the sinking ship. This is a real and problematic thing that is going on. So yeah, that's all I'm going to say as far as that. So that being said, I want to emphasize that again, I do believe that I'm at an end stage kind of psychiatric illness. It's a new kind of term that's blowing up. And kind of my life feels very kind of like, it doesn't feel like my life is starting. It feels like my life is kind of coming to a close, if that makes sense. And that's even, when I'm not having ideation, for example. It's just like your brain kind of chronologically, like I've already used all my life years up, if that makes sense. Fighting kind of this sinking ship battle. I'm going to be trying new therapies, and I will be talking about it on this channel as part of a promise to my friend that I would, try I would try other alternatives, and that way, I can tell people in their faces that I actually tried other alternatives to talk therapy and whatever bullshit suicidal ideation therapy I went through. By the way, I never explained the other part of that, which is that because half of the therapy itself is rating scales, what do you think is that? And then the other half is talk to me to empower yourself. Talk yourself through it to me. Which, when you're suicidal, severely mentally ill, you're already doing, and it doesn't work for you. That method doesn't work for you. What do you think you're gonna do? Because if you keep putting no progression, if you put higher progression in the scales, they'll hospitalize you, most likely. If you put no progression, you will continue to stay in that therapy forever. And um, if you put decreasing progression, you will end the therapy. That is ineffective, costly in time and perhaps money to you. Um, so what are you going to do? As you're going to obviously rate your problems less than they are. Because if it's not working for you, and the only real way to really kind of get out of therapy is I don't know the laws regarding like ending suicidal ideation therapy. I'm sure there's shit like welfare checks that they can do if you do that, especially if it's an involuntary court order. What I'm saying is you're going to say that your problems are less when they actually are the same or they've gone up because the therapy is ineffective. It's not helping you. You may be losing hours of sleep. You might be stressed due to traffic and getting there on time. Really, it's not doing anything, or it's even increasing your stress and making that hole bigger, right? To try to get the therapy to end, and what's very cool about that is if your problems don't resolve and you actually do end up committing suicide, the hospitals can use the rating scales in court. You know what I'm saying? Right? Well, they told me that, because it has the name reducing suicidal ideation, I forgot what the therapy is called. Because it has that, the court loves titles, like legal titles and stuff. So they'll look at it as this person was in ideation therapy, which is known for reducing suicide ideation. Which is bullshit, because people will just say their problems are less so they can get out of it. They're not actually treating the ideation in any way. It's just, it looks like that from a legal perspective, and so long as that's true, and the therapists aren't obviously going to know about this, right? Even if you have a really kind therapist, they're not going to know, like, okay, well, they just rated their problems a 5 today instead of a 7, like last time, because they're lying, right? They don't know that. You could just put it down and say a few things and they'll go along with it, right? But because it looks so good and there's quantitative kind of data that's psychologically approved assessments, it looks really good in court. So it doesn't really matter if you commit suicide or if your problems aren't fixed, at least to the the corporations that are in charge of these facilities, because they got the paperwork that said that you weren't transparent to them, basically. So, and that's on you, therefore. It's not on the therapy. Anyways, that's all for today. I just felt like kind of ranting about talk therapy, some of the therapies. I don't know much about things like CBT or DBT. I I've they seem kind of difficult to get into. I'll definitely explore it as I'm exploring more therapies against my, like, to try to combat illness. But that's what I can say as far as my experiences go. Anyways, that's all. Goodbye.